Myths about hiccups and their cures. Hiccups, those sudden involuntary contractions of the diaphragm, are something we've all experienced. While harmless in most cases, hiccups have led to various myths about their causes and cures. Let's explore some of these myths, and uncover the truth behind this common phenomenon. Myths about hiccups. 1. Hiccups mean someone is thinking about you. This is one of the most popular myths about hiccups, originating from folklore in various cultures. According to this belief, if you get hiccups, it's because someone is thinking about or talking about you. While it's a charming idea, there's no scientific basis for this claim. Hiccups are purely physiological and not connected to telepathy or social interactions. 2. Hiccups are caused by eating too fast. This one is partly true. Eating too quickly can cause you to swallow air, which might trigger hiccups. However, it's not the sole reason. Hiccups can also result from drinking carbonated beverages, eating spicy foods, or sudden temperature changes in your stomach. 3. Holding your breath is the only cure. Many people believe that holding your breath is the ultimate solution for hiccups. While it can sometimes work by disrupting the hiccup reflex, it's not the only cure. There are many other methods, and no single technique is guaranteed to work every time. 4. Scaring someone will stop their hiccups. The idea that a sudden scare can cure hiccups is a popular myth. The logic is that the fright interrupts your breathing pattern, which might reset your diaphragm. While this occasionally works, it's far from reliable and can sometimes be more annoying than helpful. 5. Hiccups are always harmless. Although most hiccups are harmless and go away within minutes, persistent hiccups lasting more than 48 hours, known as chronic hiccups, can signal underlying health issues such as nerve irritation, gastroesophageal reflux disease, GERD, or even more serious conditions like strokes or tumors. What causes hiccups? Hiccups are caused by sudden involuntary contractions of the diaphragm, the muscle that separates your chest from your abdomen, and plays a key role in breathing. When the diaphragm spasms, it causes a quick intake of air. This air hits your vocal cords, causing them to close suddenly and produce the characteristic hic sound. Common triggers include eating or drinking too quickly, consuming carbonated beverages, sudden excitement or stress, overeating, alcohol consumption, sudden temperature changes, such as drinking hot tea followed by cold water. Effective cures for hiccups. While there's no universal cure for hiccups, several methods can help interrupt the reflex arc causing them. Here are some tried and tested remedies. 1. Hold your breath. This classic trick works by increasing carbon dioxide levels in your blood, which may stop the diaphragm spasms. Simply take a deep breath and hold it for as long as you can, then exhale slowly. Repeat a few times if necessary. 2. Drink a glass of cold water. Sipping or gulping cold water can stimulate the vagus nerve, which may help reset the hiccup reflex. Some people find that drinking through a straw or drinking upside down enhances the effect. 3. Swallow a spoonful of sugar. The grainy texture of sugar stimulates the vagus nerve, interrupting the hiccup cycle. Let the sugar sit on your tongue for a few seconds before swallowing it. 4. Breathe into a paper bag. Breathing into a paper bag increases the carbon dioxide levels in your blood, which may help calm the diaphragm. However, avoid this method if you have respiratory issues like asthma. 5. Apply gentle pressure. Pressing on certain points in your body can help stimulate the nerves involved in the hiccup reflex. Try gently pressing on your diaphragm, rubbing the back of your neck, or pulling on your tongue. 6. Gargle with ice water. The cold temperature shocks your diaphragm, potentially stopping the spasms. Gargle for a few seconds, and repeat as needed. 7. Try the Valsalva maneuver. Close your mouth, pinch your nose shut, and try to exhale forcefully without letting any air escape. This can reset the vagus nerve and stop the hiccups. When to see a doctor. Most hiccups go away on their own, but persistent hiccups lasting more than 48 hours could indicate a more serious issue, such as nerve damage or irritation, for example, from GERD or a tumor. Neurological disorders, for example, multiple sclerosis or stroke. Metabolic issues, for example, diabetes or kidney failure. If your hiccups persist or are accompanied by other symptoms like chest pain, difficulty swallowing, or weight loss, consult a healthcare professional for further evaluation. Final thoughts. Hiccups are a common, usually harmless occurrence, but they've inspired many myths and folk remedies over time. While some cures are rooted in science, others are simply fun traditions with no real effect. The next time you or someone you know gets hiccups, try one of these remedies and see what works best. And remember, if hiccups persist or become chronic, it's always a good idea to seek medical advice. Stay healthy, stay informed, and don't let a case of the hiccups catch you off guard. Thank you for watching this channel.